Right now, we're in the middle of Colorectal Cancer Awareness Month. This is something doctors want everyone to pay attention to, but particularly young people, because more of them are being diagnosed with the cancer. Joining us to talk about this concerning trend is Dr. Paula Denoya with the American College of Surgeons. Thank you so much for being here.
Hi, thank you for having me.
Well, let's start by putting this into context. How big of a problem is colorectal cancer, and how much are diagnoses increasing right now?
So in general, colorectal cancer is we see about 150,000 new cancers a year in all age groups. And the reason we're talking about it more now is that we are seeing an increase in younger patients. So somebody born in 1990 has double the risk of developing colon cancer and 4 times the risk of developing rectal cancer than someone born in 1950.
Do we know why the cancer is increasing among young people?
So we believe it's multiple different factors, but likely related to environmental causes, causing changes in our genetics, and also dietary causes.
What are some of the things that people can do to reduce their risk?
Sure, there's things we can't change, like our age or our genetics, but being aware of our family history is one of the things. The other is avoiding smoking, having a healthy lifestyle that's active with exercise, maintaining a healthy weight, and eating a high fiber, fruit, vegetable, whole grain focused diet, and trying to avoid red meat and ultra processed foods as much as possible.
Obviously, no one wants to be diagnosed with cancer, but what are some of the symptoms people should be aware of and then maybe talk to their doctor if they're noticing in their life?
Yes. So knowing what is normal for your bowel function is very important. And any sudden change, like new diarrhea or new constipation, rectal bleeding, rectal pain, and also unintentional weight loss are all symptoms that we would recommend talking to your doctor about.
I know colonoscopies are so important in general, but particularly right now because we are seeing this rise in these diagnoses, but they can be intimidating for some people to prepare for. What can people do to make that process a little bit easier?
Sure. I think the first thing to know is that the colonoscopy procedure itself is pretty quick and it is done under anesthesia. You will not feel pain. You will recover right away and not have any lasting side effects. There's very low risk to the procedure itself. The bowel prep that is done ahead of time to prepare for the colonoscopy is very important, but is also the thing that I think most people are afraid about. There's a lot of newer options out there for bowel prep medications that don't taste bad, that are lower volume, so you don't have to drink as much of it. There's even pill preps available. So these are things to discuss with your doctor as to what options might make it easier for you.
Dr. Denoya, a really important topic. Thank you so much for being here today.
Thank you for having me.